Good evening, I'm Anjali Istwal and this is a special bulletin where we'll be taking your calls and your questions. But first, let's take a look at the top 5 big developments in India's battle against coronavirus. The total toll now is 173. Prime Minister will be addressing the nation today at 8 p.m. and he will speak about the coronavirus, though all the rumors about a lockdown are absolutely incorrect. They are what, as I said, they are just rumors. Prime Minister will be meeting the state health ministers tomorrow, and Delhi Archdiocese has suspended masses till March 31st, and Lucknow has, it's been clear that no Friday prayers will be taking place at Asifi Masjid till 27th. Now, these are the big things that have happened, but should citizens who believe they need to be tested for COVID-19 be sent to hospitals as opposed to being tested at their own homes? We spoke to Professor Ajit Mishra, a citizen who went to Ram Manohar Lohia Hospital to be tested, but has now been waiting for 3 days in an isolation ward for the results of his test to come back. Let's hear what he has to say about the entire process.
Professor Mishra, when were you admitted into Ram Manohar Lohia and why?
I was admitted on 16th because I came in for a test. Since I had returned from London the previous day, and in the morning I had a mild temperature, so I wanted to get a test done. So I came to Ram Manohar Lohia in an ambulance. They took the sample, and they decided to admit me till the report is out. So that was 16th, just after lunch.
And 3 days, the result still isn't out. When do they say the result will come out for you?
They say they don't know. So, as and when they receive the report, they come and tell us, saying, okay, yours is clear or whatever it is. But there is no information about when it's going to come. And
what is your condition now? Do you still have symptoms, fever?
I don't have fever, ever since I was admitted, actually. And I think I took a, very highly, what should I say, public-spirited precautionary move. And I could have, stayed at home for a couple of more days to check. So I haven't had any temperature, for the last 3 days.
And
or cough or anything.
Sure. Professor Mishra, what is the condition of the facilities around you?
It's the staff is very nice. I must say, I must begin with that. So, but facilities-wise, these are not meant to be isolation wards, because one room has 6 beds, with curtains. There's a common washroom. Doesn't have showering or bathing facilities. And the maintenance requires a little bit. For example, we don't have water supply today in the washroom. So for, a mixture of patients who might be carrying, different sorts of viruses, it's a little scary.
So no shower facilities for anybody in the quarantine, so nobody has bathed?
No, I think if I remember, the girls' wing, the girls' bathroom has some facility. In the men's, no, there isn't any. So I haven't had a shower or anything since 16th.
And all of the people who are kept over there, they are kept isolated. And so your big concern is that anybody can pick up the infection from somebody else, even if they are brought in without necessarily having an infection themselves.
That's right. That's precisely the point. Yeah.
And when you raise this with doctors, what do they say?
They say, you have to be careful. Yes, they do give us advice about, not touching your face and always wearing gloves, or, we are all been given those hand drops.
Sure.
And tissues.
Right.
So that they have provided, and we are always wearing masks.
Right. Well, Professor Mishra, thank you for speaking to us and giving us an idea of the situation there. Thanks very much indeed, sir.
Thank you. Thank you.
Joining us now are 3 doctors. We have Dr. Neeraj Nischal, Associate Professor of Department of Medicine of AIIMS. We also have Dr. Mahira Desai, Clinical Psychologist and Medical Researcher. And joining us from Bangalore is Dr. Hema Divakar. She's a senior gynecologist. Thank you for joining, doctors. I will begin with you, Professor and Dr. Nischal. You just heard what Professor Mishra had to say over there. People who believe or even if they have a suspicion that they might be exposed to the COVID-19, or if they believe that they might be suffering from some sort of a flu, should they go to the hospital, or do you advise against it?
See, there are very clear-cut guidelines who should be tested and who should not be tested. Just because you believe that you may have infection with novel coronavirus, then I will strongly suggest against going for testing without calling helpline number, where they will assess your status, whether you fall in that risk group where you may be having this infection or not. Then only they will call for infections. See, the problem which he was describing, that whenever you go to a testing facility without having any risk factor,
right,
the chances of you catching infection from there is there.
Right.
So people are, let me assure you that not everyone needs to be tested. Only if you have symptoms, if you have risk factors which could have led to you catching that infection, then only you should approach this testing center, preferably through the helpline provided, rather than directly going to those centers for testing.
Right. Now let's start taking the questions that are coming in through our callers. Joining us right now is Aditya from Bengaluru. Aditya, please go ahead and ask your question, and I request Dr. Divakar to please address this query. Yes, Aditya, please go ahead.
Yes, ma'am. Good evening, everyone. My query basically is, I'm from Bangalore, Nagarbavi area. So today I visited a local hospital over here. Actually, when I got this consultation from this doctor, because I was having like a little bit of cough and all, it was actually disheartening to see that, you know, like in videos that we see of doctors abroad, they are given proper, you know, suits and gloves. But here in Bangalore local hospitals, doctors just have a very normal, that is not even a like that proper mask. And I felt very disheartened to actually visit the medical facility is not good, and you know, it actually exposes us to much more of this thing.
Right.
Virus.
Right. Dr. Divakar.
Yeah, well, I think, Aditya, I should begin by saying namaskar, because this is probably the first code of conduct that the coronavirus demands, the social distancing. So having said that, yes, the hospitals are considered as the high-risk zone, and all the healthcare personnel are supposed to wear the personal protective equipment, like the simple things as the masks, because the droplet infection, if they sneeze or cough or come in close contact with anyone who is vulnerable coming to the hospital, can be in jeopardy. Having said that, I must put on records that the protocol-based practice, the do's and the don'ts, which are so well displayed all over the media in the last 2 weeks, the same systematic protocols need to be disseminated to the healthcare providers as well. From our organization, Foxy, we have a flagship program called Manyata, where systematically the protocols are followed for safe delivery. Being in the women's healthcare space, I can vouch for the fact that all the certified hospitals will do a proper methodology of hand washing, for example, which is given just the importance as how is disseminated by the backdrop of the coronavirus. So I think that responsible behavior applies both to the public and to the healthcare providers, and I don't think in this situation anybody should take it lightly. Right. So we are on a war footing to alert the healthcare providers as well as for the do's and don'ts, because I think given this day and age with the dissemination of information, we are very, very impressed that public at large is indeed behaving responsible. Some of them are overreacting, but I guess it is better to play safe rather than sorry.
Right. Let's take our next caller on air. We are joined by Pradeep from Trichur. Yes, Pradeep, please go ahead and ask your question.
Yes, Madam Ji. Madam, this is, please evaluate the risk to the public health that could be caused due to continued use of currency notes and coins, especially by the general public in day-to-day financial transactions, in light of the ongoing public health problem that our country is facing due to COVID-19. Now, the problem is that most cashiers, be it banks, be it any of the supermarkets, they are handling cash. We are getting the cash from them. And I do not know, is there a way to sanitize the cash that people keep in their houses?
Right. Right. Dr. Mahira Desai, if you could answer this question, how do people handle currency in this situation? And also, since you've written a book about what to know about coronavirus, this kind of fear about different things can crop up again and again amongst people.
Absolutely. So the concern with the coronavirus and why is everyone so worried despite the numbers being so low is that this virus is transmissible even through surfaces. Research is showing us that even on surfaces, currency notes, doorknobs, this virus tends to survive from a few hours to a few days. So we have to take the precautions. Now, can you disinfect currency notes? You take the precautions you can. Do online banking as far as possible. Use Paytm as far as possible. Then moving forward, what you can do to make sure, remember, you can have the virus on your hands, but it does not mean you need to have the COVID-19 disease. The virus attacks the body when it enters through the eyes, the nose, and the mouth. So if you are going to ensure that you maintain appropriate hand hygiene before you eat or before you touch your face in any way, then you're fairly protected. Coming back also, just to add that there are concerns about what needs to be done both at an individual level and at a collective level. I'm sorry for the last caller who had an unfortunate experience. The healthcare system is overwhelmed, but let's give credit to our government. We are doing everything that is possible. We are acting early, and then that improves our chances to fight and contain this with sustained and collaborative effort.
Right. Right. The government and the people have to work together. Now our next caller is Sudan from Gurugram. Yes, Sudan, please ask your question.
First of all, I want to thank NDTV for providing us this service where we can get the questions answered by experts. Thanks very much.
Thank you.
Number two, I want to ask the doctor, is it okay and safe to eat food in office canteens? In view of the fact that you have utensils and cutleries and other things there, is it safe to eat in office canteens, and should office canteens be allowed to operate at this time? And number two, should not all of us be wearing masks in office, considering that we do not know who is infected and who is not? These are my two questions.
Dr. Nishal?
Yeah, these are two important questions which everybody is asking these days. So I would like to address the mask issue first, because that is something which is a recurring subject and everybody should understand this thing. You see, mask is not going to protect you if you are not infected. The mask is meant for those who are either taking care of the ones who are infected with this virus, or for healthcare workers. If you are sick, if you are sneezing, you are coughing, then you can use mask not to infect others. But just by wearing mask, you cannot protect yourself from getting this infection. It's for a very simple reason. If you try wearing a mask, after some time you will start feeling suffocated. You will have a tendency to fiddle with your mask. So these hands are the real culprits which touch things which are infected. So if you keep on fiddling with your mask, the chances of that mask protecting you from this infection decreases. In fact, it increases your chance of catching infection. So if you have no symptoms, you have no problem, then I suggest against using mask, and let this mask be used by those who are sick or who are taking care of sick. And as far as eating in canteen is concerned, of course, you'll have to ask whosoever is managing your canteen to ensure that if anybody is sick or if he is having symptoms of URI, he should not be allowed in the kitchen. And all kitchen, even in absence of corona epidemic, I'm not talking about that this should be applicable only right now. But in any situation, you have to ensure that whatever hygiene is to be maintained, that is to be maintained. If food is cooked properly, then it should not be a concern. But if you touch that food with infected hand, of course, there is always a chance of catching this sin.
Right, and also the government is now encouraging all private companies to encourage work from home. Joining us now is Rahul from New Delhi. Rahul, please go ahead and ask your question.
Hi, thank you. Good evening, and good evening to all the experts as well. I am in New Delhi. I came back from a foreign country which was not affected on the 8th. And I had mild fever, cough, and I was told by a doctor friend to go and get myself tested. I did that on the 13th at Ram Manohar Lohia Hospital. I was told that the test results take 4 or 5 days. Today it's 6 days every day, and I can't go myself. I've been asked to self-isolate. I can't go myself to collect it. I have to beg for somebody's kindness to go and collect my results. It's been 6 days, and still there is no clarity as to when the test results would come. While I appreciate that the healthcare services are overwhelmed, but I have also heard from other doctors who are part of National Disaster Management who have checked with the DSO that if you have a negative result, you may not be informed. So what happens for people like me is I'm in self-isolation. It's been 6 days, and I don't know if I have it or not. So is there a policy that irrespective of whether you have coronavirus or not, that you will be informed? Because that is critical, because everybody is losing their minds in my office, at my home, with my parents and everyone.
Right.
And I haven't seen a human being in 6 days.
Yes, yes, Dr. Divakar.
Yeah. So I think this question is also very, very relevant, because imposing the self-quarantine is indeed the base of preventing the community infection. In 6 days' time, you haven't got your results, you're already frustrated, but you were the one who deserved the testing because you traveled into Delhi, and also that you had mild cough, cold, fever, whatever. So this is, you know, the niche segment which needs a isolation for a minimum of 14 days. You will get your test report, so hold on to your patience. Even though the test report was negative, it is ideal for you to have stayed home at 14 days for the benefit of everybody else. So the responsible behavior, what you have put in, despite your agitated state of mind, is really to be appreciated. The same applies, being in the women's healthcare space, I can say that the same applies to all the pregnant women in the country, millions of them. Today, the CDC has placed the elderly, the children, and the pregnant women as a niche, vulnerable, high-risk group of individuals. So the self-quarantine for them as well for about 2 weeks is, you know, worthwhile and appreciated. Yeah.
Right. We've got our next caller joining in, Sunil from Ahmedabad. Please ask your question, Sunil. Sunil, can you hear me? Please ask your question, Sunil.
Yeah, I am very much thankful to the panel, first of all.
Thank you.
My question is, madam, if we are feeling the regular headache or a cough or whatever the seasonal effect, whatever we are facing regular at every time, so what to do? Is it precautionary test is required, or any food or any such sort of medicine? Because we are feeling panic if we are feeling, or we are facing ordinary headache or a fever, which is normally happening in India.
Right, right. Yes, Dr. Desai, would you like to answer that?
Sure, absolutely. So thank you so much for the question. And you're absolutely right. And you're bringing to attention the fact that the healthcare needs of the country otherwise remain the same. This is an added on concern that has come. So your headache, your cough could be due to some other reason as well. But given the fact that the pandemic is spreading so quickly, given the fact that these are the symptoms to watch out for, this is the time to take the extra precautions that are required. There is a good chance that despite taking all the precautions, you're going to come out absolutely fine. So let me show you something which will help you understand and not worry so much. Because like they mentioned, the elderly are at risk, the young ones are at risk, and the pregnant ones are at risk. But of all the people who get infected with COVID-19, I would like to bring to your attention that almost 80% of those cases are mild. Only 20% are moderate or severe, requiring hospitalization, requiring medical care, and 5% of that is critical. So the reason why we are taking these extra precautions is to prevent the spread within the community.
Right. Thank you, doctors, all three of you, for joining in and answering all these questions. And thank you to our callers for calling in. We'd just like to remind you that don't be worried. Don't get into a panic mode. And the Prime Minister will be speaking to the nation at 8 p.m. and we will live stream it on our website and app. And let us tell you, all the information about the supposed lockdown is a rumor right now. Nothing is confirmed right now.